Hello, fellow students of Philosophy and Principles of Health Education. My name is Kristen Stoll, and I am here to talk to you about my health education and promotion philosophy. Before I begin to discuss my philosophy, I'd like to tell you a little bit about my professional and personal background that influences my health philosophy. I graduated in 1998 with a BS in Exercise and Sports Science with a concentration in Wellness Management from Colorado State University. I then went on to nursing school and graduated in 2001 with a BS in nursing from the University of Colorado. I have been a registered nurse since 2001, and my experience with nursing has been in critical care and emergency services, oncology, and school nursing. The majority of my healthcare career as a registered nurse was in emergency services, and currently my job is a school nurse at a public school district in the outskirts of Denver, Colorado. My nursing career has exposed me to various levels of health disparities and conditions, and has taught me ways to educate individuals and communities, and strengthened my desire to promote preventative health measures. My personal wellness is a priority in my life. I live in Colorado, where health and nature support each other. I like to ski, hike, and mountain bike, and I also enjoy sharing these pastimes with my friends and family. As you can see by my education, profession, and personal life, I have a strong roots in the realm of health, and this leads me to my master's degree program of health education and behavior. My professional goal after graduating from the University of Florida as a health education specialist is to aim to deliver health education and promotion to public school students and staff through my position as a school nurse. My health philosophy is that I maintain an eclectic health education and promotion philosophy. I emphasize that health is a dynamic and holistic experience encompassing the mind, body, spirit, and social aspects. These components are interconnected, and true wellness emerges when nurtured and balanced. This eclectic mindset also allows me to merge philosophies and connect effectively with people and communities, tailoring strategies to their learning styles, cultural values, and motivations. By adjusting the educational approach for each learner or community, I aim to empower individuals and groups to take charge of their health. This creates meaningful health education experiences that promote lasting, positive health changes while honoring each person's unique journey. There are 3 supports that I'd like to focus on that help support why I adopt an eclectic health education philosophy. The first is an eclectic philosophy intends to care for individuals and communities holistically. Secondly, an eclectic philosophy is adaptive to the setting. And lastly, an eclectic philosophy includes being culturally aware. Talking about the eclectic philosophy in the lens of a support as being holistic, I think that health is dynamic and many aspects of it are interconnected. The World Health Organization's definition of health indicates that health is a holistic concept because it encompasses the mind, physical, and social aspects of who we are. This is what we were introduced to in the first chapter of our book of Principles of Health Education and Promotion, if you can recall. When I work in a school setting, I see the whole health of the school. I see whole school, whole community, whole child model, which involves the 10 components of a holistic health approach. Those components being physical, nutrition, health education, social emotional climate, health services, counseling, employee wellness, community involvement, family, and physical environment. And then as a nurse, nurses use a lot of different philosophies and theories when we approach taking care of an individual. So here I'm drawing on the holistic nursing theory that involves healing, that healing occurs on a physical, mental, social, and existential level, and these parts interact to create balance. So as we can see that health as a holistic view Lots of different components play into health that can overlap each other and support each other. And also, in an eclectic education philosophy, we approach health education and promotion by using different pieces of different philosophies that might overlap each other when we are trying to get to the goal of taking care of somebody. My second support for my eclectic health philosophy is that health education and promotion needs to be adaptable to the setting. For example, philosophical approaches may change depending on the setting or the individual. And when I think of this in the lens of working in a school, children and very young adolescents are affected by several age-specific determinants of health and have specific health and well-being needs. And we need to adapt educational methods to the concept of health promotion when we look at children specifically. In my professional experience, I have to consider a K through 12 students' specific health needs and their barriers to learning and their mental age, and when educating them about health topics. What will work for talking to a sophomore in high school about health might not work for a third grader when discussing health. And that's why I feel it's important to be eclectic in my health philosophy so that I can approach each child or student in a way that works well for them for learning. Lastly, I want to talk about cultural awareness within my eclectic health philosophy. Cultural awareness in eclectic health philosophy fosters trust and engages individuals in health learning. As we learned last week in our Module 10, demographic changes reflected in the rise of the population among people of ethnicity impact people's health and access to health care. When I look at my nursing career, cultural competence in nursing helps improve communication with patients. And this creates a deeper trust between patients and providers and can increase a patient's adherence to treatment plans, like educating the patient. And lastly, cultural awareness enables health education specialists to effectively engage diverse populations, delivering health education and promotion that supports their unique learning and development. As I reflect on these points, knowing the characteristics and background of a diverse population can help one connect to an individual or the community. As a health education specialist, we should understand cultural dynamics because they're able to help us plan better programs and be more effective when interacting with diverse cultural groups. As you can imagine, one type of philosophy for health education and promotion might fall short when trying to better the health of that cultural group, but that same philosophy might help support and educate a different cultural group. And this is why I believe in the eclectic approach within my health education philosophy. In summary, I believe health is multidimensional, encompassing the mind, body, spirit, and social aspects. These areas require nurturing and balance to promote positive well-being. By adopting an eclectic philosophy of health education and promotion, I can take a holistic, adaptive, and culturally aware approach to health education and programming to positively impact an individual's or community's health and wellness. Being holistic, adaptable, and culturally aware in my delivery of health education and promotion helps me build connections with those I serve. It also facilitates the creation of meaningful, inclusive, and effective health education and programming, supporting the ultimate goal of empowering individuals and communities to adopt lasting, positive health practices. The following are my references that I use to create and support my eclectic health philosophy. I entertain any questions or comments that you have, and thank you for your time.